When a tendon is cut, we can always repair it. But what happens when a tendon is avulsed from the bone or cut very close to the bone where you're not able to repair it? In this module, we are going to see how to reattach tendon to bone, and we are going to see two techniques. One is the bone tunneling technique and the second is the bone anchor technique.
This is the hoof. So this is the zone 2 according to what we have classified. So we'll make an incision like this going over the skin, and then at the junction we'll make an incision like this. This is the aim, is to open up the FDP and disinsert the FDP from the insertion. Right, forceps me. So now what I'll do, I'm going to hold this, raise the flap. Okay, so now we are raising a flap on this side. Similarly, we'll extend the incision like this. Yeah. Now, this is to help in exposure. So even in the human finger, this is how we'll make the incision on both sides. We can see the tendon very nicely. We assume that this is the FDP. So I'm going to follow this up to where it's getting inserted. It's going right distally, and you will be able to feel the bone underneath here. So now what I'm going to do, I'm going to cut it over here. It's quite hard underneath, so obviously this is where the insertion is. Right, so this is the, now just assume this is the avulsion of the FDP. So the tendon was actually getting inserted like this. You can see the bone. So into this we are going to reattach this bone, this tendon, sorry. So this flap that we have raised, it's always better to put a stitch over here. That we have put stitches on this side, 3 sides. So this is the tendon and this is the bone underneath, which you are going to insert to. Just to see how we are doing it, I want you to retract this a little back and transfix it over here, instead of holding it with an artery forceps, which might crush the tendon edge. So when you're putting this, you must put it attached to the soft tissue, only then it will stay over there.
The principle of attaching the detached tendon to the bone by the bone tunnel technique is as follows. 2 drill holes are made through the bone alongside each other to exit on the dorsal skin. The suture material is passed through one of the drill holes, and then the bite is taken through the tendon and then again through the other drill hole to exit on the dorsal aspect. This, if tied directly, will cause pressure on the skin, so it is tied over a button. As it is tied, the tendon is drawn very close to the bone and attached to it. To create this drill hole, instead of using a K-wire, an 18-gauge green needle with the hub cut off. Once you pass this needle through with a hand drill, with the sharp end going to the dorsum, we thread the suture material with the needle on the proximal aspect and the thread on the distal aspect. We cannulate it through and leave the needle on the proximal aspect to take a bite in the tendon. Now the needle alone is cut off, leaving the thread long. The procedure of drilling the bone with the needle is repeated alongside the previous drill hole, and the free end of the thread is now threaded through again. These free ends of the thread can be tied over a button.
Cut the hub off the needle like this, so you have a cannulated nail like this. So now what we have to do is we have to pass it, and it must come out on the dorsal aspect over here. Now remove the drill. So now you can identify the proximal end over here.
If it is difficult to thread it due to blockage of the needle by some bone bits, we can always pass a smaller needle from the distal end through and then thread the suture material.
Yeah, so now the needle is taken out, the thread is there. Pull it nicely till the needle comes here. We'll take a bite in the tendon. Now the bite we take in the tendon should go like a horizontal mattress. Right, now we have taken a bite here. Now we need to take another bite over here to exit at the cut end of the tendon. We have to pass another drill hole. Now cut this end of the thread and thread it again through this. Now we are threading it through the needle. So now this is the button which we have sterilized and kept ready.
The two free ends of the suture are now passed through this button and then tied. As it is tied, we must make sure that the tendon is pulled very close to the bone and then apply the knot of the suture over the button. We can test the strength of the repair by pulling the tendon proximally.
We are going to pass the anchor suture. So first we will drill a hole with this drill bit. You will put the anchor that has been provided to you. You can see that hole over there. That is the end of the bone. Terminal phalanx you will be putting here. You can put the anchor into that, and the video that's going to be shown now will show how the anchor will go in and come out. We have not used the anchor to save the anchor for your usage. What you will be seeing when you unpack your apparatus. Here you have the tip, you have the anchor. I'll just turn it around, you can see the shape of the anchor, and the shadow shows it better. You can see that those flanges that come on both sides, and this is the anchor. You can see two threads coming out on either side getting into the lock. So once you get to the bone, you have made a drill hole already. You go in and keep drilling it through. You have to screw it into that hole that you have made. Once you have made that hole and it is snugly fitting inside, just remove this lock on top. Remove it completely, and then you can see a thread over here, the suture material here. Just remove the suture material. Once you remove the suture material, and you can pull it out. When you take it out over here, take it out from here. It is attached to this apparatus. Remove it completely, then pull the applicator back. So then it will get disconnected from the flange, from the anchor, and come back. It will be then held only by the anchor with the two threads and two needles that you can see inside. I am not removing it now because I want this to be used also. Okay, the two needles inside this. So it is, yeah, you can see the two needles which we can be using for the suturing to the tendon.
So the tapping is done as we have already shown. Once that is done, the anchor with the applicator is screwed inside the hole that we have made in the terminal phalanx base. The thread is disconnected, the applicator is removed, and using the two needles of the thread on either side of the tendon, a stitch is taken and tied securely. This secures the tendon to the bone.